Jill and Stacy Show.
We are here today with Tom Ballinger.
My name is Thomas Ballinger. I'm running for 5th District Senate. Former military, I'm actually a disabled veteran. Veterans hold near and dear to my heart. You know, veterans need to take care of veterans. I'm also a resident of Butler County, Kentucky. I'm a past president of Kentucky Beekeepers Association, and I still sit on their board of directors. I've sat on the board for Heartland Agriculture Society, Eastern Agriculture Society, and American Honey Foundation. I've worked in hand with the Department of Agriculture for fair committees and fair logistics committees also. Working with other organizations is not an issue.
So what made you want to run for the Senate in the 5th District?
The Senate in the 5th District, the more I looked at it, you could ask a question and you wouldn't get an answer. I said, well, that's just Senate leadership. That's the only answer we could get, Senate leadership. Senate leadership does not vote the senator in. Your constituents do. So if your constituents ask you a question, you don't tell them Senate leadership. You explain to them why. Lack of representation. I got tired of complaining about it, and my motto is put up or shut up.
Where do you stand on the certificate of need?
I think the certificate of need actually holds the state back. 16 states that have certificate of need. Some of them just control ambulatory services and some of them just control senior homes. The certificate of need regulating as much as they do the number of beds, the personnel, the MRI machines. It's a way of the government controlling your health care. If it's a free market, it's cheap. I've done cross analysis with states that don't have certificate of need, and we actually pay more for, say, a knee replacement or a hip replacement. Competition brings prices down.
What do you think about the Senate as it currently stands?
As it currently stands, the biggest thing that aggravates me about the Senate now is I really think they overreach. To give you, for instance, I'll go back to right to 241. They said a juvenile 16 and 17 years old no longer has to have parental permission to buy a hunting and fishing license. So my question was, okay, what if they get hurt? What if they hurt somebody? Is it your responsibility? They said, no, it's still the parent. By law, they can buy a license. They're my kids. Let me raise them. There's a lot of other issues that they can take care of in the Senate. You know, there's over 600, according to HUD, there's over 600 homeless veterans. Once you look into that, there's a lack of mental health providers in the state. Look into that. You know, leave our kids alone. The critical race theory that they pushed real hard for the last 4 to 5 years, that's totally screwed up our schools. And now they're trying to get out of it, which is fine. But how they're getting out of it is say, okay, we're going to vote to get rid of it. You know, our kids' heads are all screwed up from that. And a lot of teachers don't like it.
Well, we also found that they're just changing the name of the CRT, the DEIB, and they're calling it the Equity Playbook. First,
they got away from critical race theory and they went to AGT, then they went to DEI, then CET. It's all still the same program. Let them teach the kids how to read, write. Kids nowadays don't even know how to write cursive, much less balance a checkbook. I'm all for freedom of religion, freedom of speech, and everything like that. But you have to give our kids an education so they can survive in this world. I will represent the people. I don't care what Senate leadership says. I will go with the party. I have no problems with that. But when it comes down to an issue or somebody for my district, the fight's on. What we lack now days is representation. They're all looking out for themselves, for re-election, for an additional committee. It's not about that. It's about representing your people. We do not have that right now.
What is your stance on medical freedom?
Medical freedom, you got to have a choice of where you're going to go to the doctor. If it keeps getting regulated to where using the certificate of need to where it's, you know, that's the only provider in your area because that's all certificate of need will allow, that's just not very viable. If you just don't have that contact or that, you know, that initial or have a good relationship with that doctor, you're just not getting a real good treatment. I like the freedom of choice. Extremely. You need to be able to pick which doctor you want to go to or which facility you want to go to. Some medical facilities are a lot better.
Do you have a stance on medical freedom as far as vaccinations go?
My personal thought is the whole time through the military, I had to take vaccinations. I hate them with a passion. I do not want the vaccination, but there are, in some cases, there are people that are immune deficiency, and they may help that. I do not know. I don't know the studies. I don't know the scientific data, but I do not think you ought to be required to take a vaccination of any shape or form. The gentleman I'm running against is on the Veterans Affairs Committee, and I followed the committee all summer, just trying to see what was going through. 3 of the 5 meetings they had this summer only talked about closing a road down in front of the Capitol, not addressing lack of veterans funds. You've got some clinics now that are open. They've just got a nurse practitioner in them. They don't have a lab. They don't have an x-ray, and they're shorthanded. As far as medical service, the doc can just say, okay, you need to go to Nashville or you need to go to Louisville and have this done. You know, they do not have the equipment at a lot of these clinics that can give you a real good checkup. If you've got to wait 2 weeks for blood work, 2 weeks may be too late. There was a study, they were talking about the lack of veterans health care through the clinics in the last 5 years in Kentucky. Even though they've got the separate clinics put in regions now, veterans were still having to wait 4 to 6 weeks for an appointment. So I contacted one of the medical providers and asked him, I said, how many patients do you have? He said, I'm here 5 days a week. I see a patient every 7 minutes. That's one doctor in the clinic, one every 7 minutes.
I don't know why the federal government doesn't give veterans just a health insurance card that will cover any medical choice that they want to make with their bodies once they're out of the military. Like, why do you have to go to the VA? And if you're not utilizing the VA, they make you pay for those services.
There is a program for that. And if the VA, say, like for me, if it's over 8 weeks out, they can send you to a civilian doctor. 8 weeks is a long time for somebody to wait. And I wasn't aware of this till this morning. They've got a program. If you've got an emergency, you're allowed 2 emergency room visits a year through the VA. And that's going to, say, if in our area, if you wanted to go to Greenview Hospital or the medical center, you're allowed 2 a year. But that's only for emergency. The VA knows that their system is broke. There was an article this morning, senator out of Tennessee, where she was talking about where VA funds were pulled for a lot of immigrants that was coming in. A lot of the VA personnel that do that crossover to the civilian market and said they had seen a lot of people that didn't have veteran status on their list. So, but I am going to check into that right there thoroughly, because I fully believe our veterans are not being taken care of the way they should be. I've seen some veterans in real bad shape, and then when you take them to the doctor, they give them some Motrin, ibuprofen, send them on their way. It needs a lot of attention. Our Veterans Affairs Committee, Senate Committee, is doing it justice.
You mentioned available care. In Northern Kentucky, we do have a small office, like you were mentioning, with nurse practitioners. I don't know if there's a physician there, but we have to travel to Cincinnati for our VA services. And that's another thing that goes along with the CON. A lot of our services for medical freedom, we have to travel across the river because we only have one hospital system here. They are located in 4, I believe, maybe 5 counties. And Northern Kentucky is a lot bigger than that. They closed the one.
Carrollton said they did not have, it said it wasn't sustainable, which doesn't make any sense why it would say it wasn't sustainable. The certificate of need is limited everything, and Kentucky is just about one of the strictest ones for the certificate of need across the board. I've talked to veterans when we travel a lot through New Mexico, through Arizona, into Oregon, Southern California, and a lot of the states that don't have certificate of need, their veteran services are a lot better due to the open market of availability. I am not going to do a bill that tells a hospital how to run, because that's not my area of expertise. The less laws that the Senate puts through and the House puts through, the more the people will like it. But they have to be good laws, not open-ended and up for discussion or who interprets it this way or who interprets it that way. Put it in black and white and make it to where people understand.
So you want to talk about SB 24? Tom?
This is the 7th year that Mr. Meredith has tried to get this through the Senate, and it's an administrative law. Senate Bill 24 is a one-page bill that is basically slowing our medical system down. Questioned them about it. They said, well, we're going off the Tennessee model for how they do their Medicaid. So I looked up Healthcare Insider. Kentucky's 22nd right now. We're not the best in the world, but we're close to middle. Tennessee's 40th. They're at the bottom. So why would you want to model something off them? If you're going to model something, go high. Go big or go home. It's got some of the healthcare providers very worried about it. I've got several doctor friends, and they're worried about it because they don't know which direction it's going to go. It's a one-page bill that has no details at all. And that's what spooks them, because it's open for interpretation several different ways. And to give you an idea about how much this bill will affect, there's 190,000 people in Kentucky that are on Medicaid and Medicare, Medicaid or Medicare. 40% of that is children. 52% of those children are special needs. So I've got some friends that have special needs kids, and they said when they get a sinus infection, something, because their immune systems are a little deficient, they're saying it takes them 3 to 4 weeks before they can even get into a place, much less see a doctor. Some of the special needs really need a specialist when they're seen. And they're worried about this too, because their providers have already told them, you're going to see a delay after the first of the year. Just now into January, and this bill's passing or about to pass, healthcare providers are already looking a year out, because most of the time it takes them 2 to 3 months to get billing through Medicaid. It's got the medical organizations worried due to the lack of transparency with this bill. Not only are they doing this bill, which it may work out, may not, but they're wanting to form a separate committee for this bill. That committee cost over $30,000. If you figure the senators' pay and the LRC staff, it's over $30,000. And that committee is wanting to meet monthly. So it will be more than $30,000, because I only figured on a 9-month span. They've got committees that handle that already. And during the summer, those committees aren't very busy. And they're wanting to do a committee for DEI. DEI was shoved down our throats last election cycle and the election cycle before that. It's not conclusive, and they know it. And the higher education level, it's really bad. I've had several professors that reach out. The lack of teachable moments. It's turned in from a place of learning to a place of tolerating. And a lot of your professional teachers are getting away from it. They're moving.
So my biggest concern is they're wanting to pick 3 managed care organizations. We already have enough of the insurance companies. Your bigger insurances are controlling our health care. So who's going to be, so you're saying this committee is going to pick these 3, and we already know that they all have lobbyists that spend a lot of time down there trying to get them to pick me.
Yes, ma'am.
This is going to limited areas, because some of these rural areas may not even have large conglomerates to cover.
Exactly. What that's going to do, and one of the smaller places here, he said, if one of our healthcare providers is not picked, he goes, we'll have to reorganize, either sell out or reorganize with another healthcare organization. He said, I've dealt with healthcare in 4 different states. He said, I like Kentucky. I like raising my kids here. I like the environment. He said, but the healthcare system is turning more and more into a monopoly. And if you look up the CON system, the certificate of need system, that's exactly what it's compared to.
That's why I was so happy to see that you were putting your hat into the ring, because we already know, in dealing with Steve Meredith on the CON, that he was he a CEO or COO of a healthcare facility the majority of his career? So he's seeing this from the corporation side. We need someone who's going to see this from we the people side.
Like I said before, if it comes to me, if it doesn't benefit the people, I could care less about the insurance company. I could care less about the commercial entities and all the private lobbyists that's up there, in my opinion, there shouldn't be a lobbyist one on that hill.
Amen.
Let the people and the senators talk about it. And then one thing you run into is the way our legislative is set up now, you've got some senators with one committee, House Joint Committee, that meets maybe once every 2 or 3 months. And then you've got some senators that got 8 or 9 committees. Well, if you got 8 or 9 committees, you're not spending any time in your area at all. You're spending your whole time in Frankfurt. So therefore, how are you talking to your people? That's why I started this run. People can look my issues up. They can look what I stand up for on my Thomas Ballinger for State Senate, or vote Ballinger on the internet. All of them have what I stand up for, and I will not waver.
Use your brain and do your research.